tell me when you're going. Good. Okay. Hi, sir. I'm Lily. I'm going to be your nurse today. I just shut the door for privacy, so we don't need to close the curtain. We are just going to be doing a baseline assessment, and then it looks like the CNA has already taken your vital signs, and those look good, so I'll just go ahead and chart those. And then we're also going to be placing a Foley, and then she said you were complaining of some nausea. You are? Okay, perfect. And we can give you that for your IV because we do have a doctor's order for that. So I'm just going to go ahead and get started on your assessment, okay? All right. Okay. I'm just going to sit your head up. And then do you have any questions for me? No? Okay, perfect. And then I'm just making sure that her wristband matches a name, and it does. And then can you tell me your name and birthday? Okay, good. And that also matches what I have on the computer. Okay, perfect. So we're just gonna start on your assessment. Do you have any allergies to anything? No? Okay, perfect. And then do you know where you're at? Okay, do you know what day it is and what time it is? Perfect. And then, do you know who our president is? Okay. Patient is alert and oriented ×3. And then I'm just gonna turn the lights off for a minute to check her pupils. Okay, pupils are equal, round, and reactive to light and accommodation. Perfect. And then can I just have you follow this for me? Good. Perfect. Okay, and then I'm just gonna look in your mouth. Okay, and then I'm gonna look in your nose, and then in both of your ears. Okay, and everything looks good. Can I just have you squeeze my hands? Good, okay. And then I'm just gonna have you push on my hands with your feet. Okay. And then we're gonna go ahead and just check her pulse while we're down here. And then I also, when I walk in, just do a general assessment of the room and make sure that nothing's like dangerous or hanging on the floor. Okay, her pulses are equal and strong bilaterally. Well, we actually need your socks off for just a minute. And then I'm gonna check her cap refill in her toes. Okay, and they are good. Do you want your socks back on? No? Okay. She doesn't want those back on. Awesome. And then I'm going to check the cap refill in her fingers as well. And it's less than 3 seconds, so that's good. And then I'm just going to check her skin integrity and checking for turgor. Okay. And it bounced right back, so that means she's not too dehydrated. Okay, and then I'm just going to feel your head for anything abnormal, okay? Good, and then I'm just looking for anything abnormal as I'm feeling. Can I have you push your head against my hand? Okay. And then push against that way. And then can I have you tip your head up and down? Good, and she can do that well by herself. She doesn't need any help. Okay, I'm gonna go ahead and listen to your heart, okay? And then we're gonna listen to the 5 different points. Okay, so we're gonna listen to your aortic, okay, pulmonic, Herb's point, tricuspid, and then we're listening to the mitral, or the point of maximum impulse, and we'll do that for 30 to 60 seconds just to assess the rate. Good, okay. S1 and S2 sounds are present, and then I'm just gonna go ahead and listen to your lungs, okay? So you just keep breathing deep for me. Okay, and we're gonna listen to 6 different spots, and then I just move each time she takes a breath. 3, 4, and then we're gonna go under your breast, sorry. 5 and 6, okay, good. And then I'm just gonna have you sit up. Can you see? Okay. And then we're just gonna listen to 6 points on the back as well. Oop, right there. 3, 4, 5, 6. Okay. The lung sounds are equal and bilateral, and then I'm just gonna lay you down a little bit, okay? And then when was your last bowel movement? Okay. Do Do you have a hard time urinating or any pain, discomfort? You haven't been able to pee for a while? Okay, we do have an order for a catheter, so we will put that in to help with that, but no pain when urinating? Okay, awesome. And then I'm just gonna go ahead and listen to your stomach, okay? Perfect. I'm just gonna pull this up. Ooh. And we're naked under there. Okay, so I'm just gonna listen to the 4 different spots. Okay, bowel sounds are present, and then I'm just listening for bruit here at the top. Perfect. Okay, again, sounds are present. Okay, and then I'm just gonna push on your abdomen and just tell me if it hurts, okay? 1, 2, just applying a light pressure. 4, did that hurt at all? No? Okay, perfect. Okay, and then I'm just gonna pull your blanket off. Now I'm just looking at her skin. I'm looking at the color, feeling if there's any temperature. I'm looking for any edema, swelling, redness, sores. I don't see any of that. Do you have any sores anywhere that I haven't seen or need to know of? No? Okay, perfect. And we're gonna cover her back up. Okay, and then, Sarah, I'm just gonna have you sit on the edge of the bed, and can I just have you walk to the door for me? Okay, so I'm just assessing her gait and making sure that she can ambulate without help, and she did a great job. Okay, you can go ahead and sit back down on the bed. Perfect. Trying to think. Did we miss something? Oh, okay, so are you in any pain? Okay, good, yeah. So my patient is not in any pain, just complaining of nausea. I don't know why I'm sitting her up. We're gonna sit you back down, Sarah, to do your medication and then to do your catheter. Okay. Okay, and then just tell me if you're uncomfortable at all, okay? And then we'll go ahead and administer that medication first, that way you can start feeling a little better. That's too tall. Okay, so I'm just gonna come over here. And then I've already done my patient checks. I'm gonna go ahead and just look at the medication we're giving. And let's see, Dazatron. So just for nausea. And I'm just gonna mark off that I've done my baseline assessment already. Okay, so I know that that's done. I have her vital signs, and I'll chart those in just a minute. Why is it not? Whoa. I don't know why it's pulling that up. We're gonna go back. Okay, so I just want to, I don't know where it is. Oops. Where? Okay, right there. And it's PRN, so I'm just gonna click on it. I don't know why it's saying it's already administered. Okay. Not sure why it's saying it's already been administered. It's not supposed to be. We'll just go back to the orders and see. Oh, there we go. Okay, I wasn't in the MAR. I was in orders. Oh, that would be why. Okay, so we're gonna go look for the Where'd you go, little turkey butt? Okay, right here. So again, I'm just making sure it's the right patient, and I've asked her name already. Okay, and then I've just got to scan her barcode. Perfect. And then I have the medication right here, and it is the Ondansetron, so I'm just making sure, again, checking and reading the name, making sure it's the right medication. And scanning the barcode. And it's trying to scan upside down. they accepted it. And then again, just doing a check to make sure it's the right medication for the 3rd time. And then I want to make sure that I do my 5 rights. So I'm making sure that it is the right time, it's the right dose, right route. We are going to push it IV like the order says. And then I'm just making sure that it's the right dose. Okay, and it says 4 milligrams IV. So we need to change that into maybe where it's at. It's probably up here somewhere. It doesn't say. I'm confused as to why. It should say how many mLs per milligram, correct? Or why it's not on here? I'm confused. Doesn't make any sense. It just says 4 milligrams. It does me no good. Okay, it says 4 milligrams, but there's no telling me milligrams per milliliters. So it's back out here. Okay, you can shut the door. Okay, well, we're just gonna check our dosage real quick. Okay, so I'm just gonna put her vitals into the thing real quick. that's in Fahrenheit, so we're just gonna convert it to Celsius, or to Fahrenheit 36. Okay. All right, and then I think those are all of her variables. Okay. Trying to okay, so oh, it's gonna make me rescan that barcode. Okay, so again, I'm just checking the medication to make sure that it's correct. Okay, and then again, just checking my 5 rights, making sure it's the right reason, dose, route, and time. And then just checking my medication again. So I want to say I can't think. Ask her a question. I'm recording, but I have a question. It says that it's 4 milligrams, but it doesn't give me a conversion.
Okay, so
like there's not one on the bottle or anything.
here, take the bottle.
Okay, thanks. That makes more sense. Okay. Now that we know that. Okay, so the bottle says 4 milligrams to 2 milliliters. Okay, so now I know that. So that's good. I'm not just crazy. Okay. So 4 milligrams per 2 milliliters. So if I'm giving 4 milligrams, I'm just going to be giving 2 milliliters. And then I'm going to get my alcohol swab. I've already performed hand hygiene, but we can just do that again. And then go ahead and put these on. And they're super fast. Okay. Alright, so I've got those on. I'm just going to open my flush here. And I'm going to go ahead and just clean the top off. She's strong. Okay. And then it really doesn't matter what syringe I use since we're just doing 2 milliliters. I can kind of use any of them. Okay, I'm gonna uncap my needle, throw that in the trash, and then I'm just gonna fill it up with 2 milliliters of air. Okay. Oh, I don't know if there's enough fluid in here, but we're gonna try. I don't think there is. Okay, looks like maybe there's enough, barely. Okay. Okay. There is. Damn. Oh. Okay. And then we are just barely below 2 milliliters because I did not quite. I barely had enough in that vial. So we're just right at 2 milliliters, which is what I need. And then I'm gonna go ahead and cap my needle and take it off and put it in the sharps since we are going IV push. And I've got my flush. Okay, and we're just gonna come over to the patient. Okay, this is your nausea medication, okay? So I'm just gonna go ahead and scrub the hub for 30 seconds. 11, 30. Okay, so that's been 30 seconds. So I'm just going to push, oops, just 3 ml of fluid just to make sure my IV is still patent. If she's gonna let me. Maybe. She's still connected. Oh, it's like a kink back there. Okay. So we're gonna go ahead and push just our 3 ml of fluid. Okay. And then without touching the hub, I'm gonna go ahead and put my medication on. And then I'm just gonna double check how fast I'm supposed to push that. Okay, and it does not say how fast to push. So with this one, I'm just gonna push it slowly over about 2 minutes, since I don't know. I can't see the time. There we go. Okay, so we're just gonna wait another minute and then we'll go ahead and push the rest. Okay, so it's been about 30 seconds, so I'm just gonna push 0.5 more. And then once it hits on the minute, we can go ahead and push the rest of the 0.5 mLs. Just waiting. So normally if the order said to push it over so many minutes, that's what we'd use. But since we don't know, we're doing 2 minutes, and then there's my last 30 seconds. Okay, and then I'm going to just slowly push, I shouldn't have capped that, another 3 mLs of fluid just to make sure that all the medication has gone into my patient. And I'm just gonna kind of slowly push this at first, just in case there was still some in the line that didn't quite get into my patient. Okay, and now I'm gonna go ahead and push. Perfect, okay. Awesome. And then I'm just gonna come over here and chart that that was administered. chart that I administered that medication. Okay, perfect. And then the last thing we're gonna do, Miss Sarah, is we're gonna insert a Foley catheter. Okay. Due to your urinary retention. I can keep this. Catheter. Okay, it doesn't. Okay, so I'm just checking my order for my catheter. Okay, and we're just gonna get everything set up for them. Okay. Okay, so I'm just gonna get set up for that. And then I'm gonna actually go ahead and, it might be okay with that farther. Okay, Sarah, I'm just gonna move your blanket out of the way. And then this is actually probably a good working height for me, so we're just gonna stay, leave that there. Okay, and then I'm just gonna get all of my supplies ready. All right, Sarah, I'm just gonna put some gloves on and then we're just gonna wipe you up real quick, okay? And I actually take that off. Okay. Okay, so I'm just gonna take are you comfortable? Okay, so I've already explained to my patient the procedure. I know I've asked you about allergies, but do you have any allergies to latex or iodine? Okay, perfect. Just so we know we're not going to cause her any harm because we are specifically using that today. Okay, and I'm going to use my wipe and wipe 3 times. Okay, making sure that I use a clean side of my wipe every time. Perfect. And then going to spread her labia and wipe down the center. And we are going to do that. I'm going to stick this in. My pen. Okay, that's good. I'm just going to go ahead and open this up. And I need that. So I'm actually just gonna initial and date it right now. And then it's the 25th. That way I can just stick it on when we're done. And then I'm gonna go ahead and open my sterile field. And then just making sure that I'm walking around it. I never want to reach clear over it. If it would behave. Making sure that I only grab the outer inch. Oh, you're such a bugger. Okay. Being turd. That's what we're gonna do. Okay, and then I'm gonna go ahead and take my sterile gloves and put those on. Again, making sure I'm only grabbing the outer inch. Okay, and I'm gonna go ahead and get my donut. Okay. Making sure I grab the inside of these ones. Awesome. Okay. And then I'm gonna just pinch the top to make sure that I've got that okay. And then I'm gonna grab my drape. Carefully open it. And then make sure my hands stay above my waist. Unless I'm placing something in the trash. Okay. And I should have had my patient bend her legs just a little bit, but for now that's gonna be okay. Are you comfortable right there? Okay. Her legs are spread just a little bit, so I think we're okay there. And then I'm gonna open my second drape. Okay, and I'm just going to place this over her peri area here. Just making sure that I'm not touching her skin again. Okay. Don't need those. And again, just throwing things in the trash, making sure I'm not touching the garbage, obviously. Okay, and then I'm just gonna go ahead and place this right here. I already have one of those. And I'm just gonna set these on my tray. Okay, and then I'm just gonna set this again on the sterile field. I don't really need it right now. And then I'm just gonna go ahead and pull that off and throw it away. And the catheter just hit my sterile field, so it's still clean. Okay, just going to open my lube, stick it on. Perfect. Okay, and I'm gonna put that back in there. And then I'm gonna go ahead and just get this ready and go ahead and just stick my saline flush right on there. And then this catheter calls for 5 mLs when we blow it up. So that is how much fluid we're going to push. And we've got lube all over. Yummy. Okay. And then I am going to use my non-dominant hand to be dirty, just making sure again that I'm not turning my back to the sterile field. So I'm still facing it. We're gonna start on the outside with one iodine swab going down just to make sure that we're pushing the bacteria to the middle, and then we'll wipe the middle last. Okay, and then I'm gonna spread with these fingers and go ahead and wipe down the center. Okay, and then are you doing okay? She's doing great. And then I'm just gonna go ahead and pick my tray up, and it is still sterile, and just drop it right here onto my sterile fill. That's fine. Okay. And then with this hand, I'm just going to maybe pull the lube packet off. Okay, Sarah, I'm gonna insert this, okay? Just nice and slow, just kind of bear down like you're going to pee. Oh, and her hole's clear down there. Okay, well, that's fine. Okay, and I'm just gonna insert it into the patient. Okay, about until we feel resistance. Okay, and then I'm gonna fill my balloon up with 5 mLs like it says on the package. Okay, and I filled up to 5. So I'm just gonna go ahead and tug on that to make sure that there's resistance. And I'm not gonna pull forcefully, just, I don't know if you can see, you can see the resistance there, okay? And then I'm just gonna go ahead and pull this out of the package. And then I no longer, oh, okay. So let me just grab a new catheter and we'll start over. Okay. Sorry, Sarah. So we're just gonna start over since that came out. Sorry about that, and then we'll just make sure it doesn't happen again. Okay. So I'm just gonna perform hand hygiene again, and then I've already wiped my patient with the wipes, so we don't need to do that again. We will just start by setting up the sterile field again. I already have one of those. And then I'm gonna grab a cap secure out of my bag. There's not one in my kit. And I'm just gonna get it ready. Okay, and that doesn't need to be sterile for this little guy. Okay, so I'm gonna start again, opening my sterile field. Making sure that I'm not reaching over it. Okay. Ugh. I'm just gonna make sure that I'm only grabbing the outer edge. Okay, and then before I touch my sterile field and put on sterile gloves, I'm gonna go ahead and have my patient just open their legs a little bit. Okay, and then, are you uncomfortable? No, she's doing okay. So I'm gonna perform hand hygiene again. And then we'll go ahead and put sterile gloves on. Okay, so I got my sterile gloves. Just gonna go ahead and open this cover. Making sure that I only touch the outer inch of the package. That's fine. Okay. And then I'm just reaching under my glove. Oh, actually, okay, so for these, I'm just gonna touch the top of them so I don't get them dirty. And we'll reach under on the second. Okay, there we go. So that's good for now. So now I'm gonna go ahead and reach under my glove. And then go ahead and put those on. Okay, and then I'm gonna grab the middle so I'm not getting anything contaminated. My nose is gonna itch. Okay, I'm gonna grab my drape and I'm gonna open that. Make sure I don't shake it. And I'm just gonna go ahead and place that right here, making sure I stay sterile. Oh my gosh. Okay. I'm gonna go ahead and grab the corners of my drapes. Okay, and then drape that over my patient, and she's still doing okay. Okay, once again, just making sure that I don't touch anything dirty. Okay, I don't need those. I just need one package. And I'm just gonna set those onto my tray. Okay. All right. And I'm just gonna set that off to the side. Everything on here is sterile, so I'm okay touching it. Okay. And then I'm just going to go ahead and open up my lube and put on the tip of my catheter. I can get it open. Okay, and I'm just gonna leave that connected, and then I'm gonna go ahead and put my flush on. And this catheter calls for 5 mLs to fill the balloon up, so I'm just gonna keep that in mind when I do that. Okay, and then I'm gonna just make sure that I'm not turning my back to my sterile field. And then I'm gonna use my non-dominant hand for my dirty hand. Just gonna wipe once on that side. Just making sure to go in a downward motion, wiping the other side. And then I'm going to spread the labia and wipe once down the middle. Okay, perfect. And then I'm gonna go ahead and just grab my catheter. Okay. Bring that over here. Once again, I'm just making sure to keep the tip here sterile and not touching it to anything. Okay, I'm just going to have you bear down kind of like you're peeing, and I'm gonna spread her labia. Can't tell if that's a pee hole. It's not. Okay, so I'm just gonna insert it into the patient, and I'm gonna switch to my dirty. Just hold it with my dirty hand, and I'm gonna insert it until I feel resistance, and then go ahead and until I see urine, and then I'm gonna go ahead and put 5 mLs in to blow the balloon up. Okay, perfect. And then I'm gonna just disconnect that. Throw it away, we don't need that anymore. And I'm just gonna tug, and I am feeling a little bit of resistance, so we are in where we're supposed to be. I'm gonna go ahead, I no longer need to be sterile, so I'm gonna go ahead and secure it to the patient's leg. Gosh, if I can talk. Okay, and then do you have a preference in which leg? No, okay, so she doesn't care which leg it goes in or on. So we're gonna put it on this side just so it's a little bit easier access. But to do, and we want it to have enough slack that it's not going to tug on her urethra or tug on the balloon, but we also want it to be tight enough that it's not just going to get yanked out. Okay. And I'm going to go ahead and just secure the catheter. Perfect. And then I can go ahead and clean up. That doesn't want to stay. Okay. And her catheter secure did not want to stick to her leg, so I would just secure that with some more tape. And we'll just press it down for now. And then I'm going to hook this onto the metal part of the bed. I just don't want to hook it onto the bed railing. I'm gonna go ahead and take that off. Okay. And I'm just gonna hold it for now since it is wiggling a little bit. Okay, Sarah, how are you feeling? Okay, she's feeling a lot better now that we've got some urine coming out. And I would just cover my patient back up for privacy and make sure to take my gloves off. Okay. And then I'm actually gonna put on a second pair of gloves to obtain my, I don't know that I need a urine culture. But if I did need a urine culture, I would put my gloves back on. I don't believe that I do. Okay, it doesn't say that I need a urine culture, so we don't need that. And then I would just go ahead and make sure that I put my sticker with the date and the time, or the date and my initials. I'm just gonna put it right on her catheter secure, just right there. That way they know who inserted it. Okay, sir, is there anything else I can do for you? No, you're doing okay. All right, so I've charted my patient's vitals. We've administered the anti-nausea medication and then inserted the catheter. So I would just monitor her for any complications and make sure that she's comfortable. And then I'm just going to lower her back down. My patient does not want to sit up. She wants to go to sleep. And then I'm going to make sure her bed's as close to the ground as possible and put the rails up and leave her with her collet and her water. And then I'm going to perform hand hygiene. And I'm done.